This is the second class of radiology. Yesterday we talked about introduction part in which we discussed about who invented X-ray, invention of X-ray, and types of radiology, and why we select radiology for diagnostic purpose. So yesterday in detail we discussed all these topics. Today we will talk about basic things. Okay. So basically we have the radiology. Okay. In radiology, various diagnosis tools are available on depending on the race. Okay. So we have those some race, whatever race. So basically, first you have to see this image. First, I will explain the X-ray. Okay, how the X-ray will uh, produce. Okay, this is the X-ray tube. Okay, so this is fixed in every scanning department, mostly in like X-ray machine. CT machine has different types of tubes. MRI have different types. Okay, we'll discuss. But X-rays, this is the basic thing. Okay, in that you have different parts. Okay, one is cathode. Okay, this is cathode. Okay, minus. This is anode. This is positive. Okay, the electricity which is passed from this cathodes travel. Okay, travel. So it is anode and cathode. Positive and negative charges are covered with glass envelope. So this is the glass envelope. Okay, this is the target area, and here you are getting X-ray photon beam. Okay, so this is how the X-ray will come out from this X-ray tube. Okay, basically the energy which is coming into this cathode, the electricity current. Okay, only from that current only we have 100% na? In that 1% only it will convert into X-rays. Okay, 1% convert into X-rays. What about 99%? The 99% is heat. Okay, so there's the reason in X-ray room, CT room, MRI room. So they have very highly packed and sealed. Okay, and as well as they have z- degrees Celsius. They will keep that machine in that AC. Okay, so always it will cool down. Okay, so whatever electricity we are sending, kinetic energy, positive energy, kinetic energy is sending. Okay, only in that 1% it will convert into X-ray. Okay, wave. Other 99% is heat surround the area. Okay, so this is the cathode. So cathode is made up of the element. Okay, that is tungsten and thorium. Cathode. This is the basic details. Cathode is made up of tungsten plus thorium. Anode is made up of same tungsten plus rhenium. Okay. So why they selected this? Because they have very high melting point, because they cannot easily melt easily. Okay. So that is the reason they selected tungsten, thorium, tungsten, rhenium. Okay. So these are the basic things we have to understood. And another thing we have to know that, so whenever X-rays are passing through this tube, so this is the fixed. We have this is the target area, this fixed. In some X-rays, the rotating, the target area will rotate. Means the X-ray which are going on target area, okay. So due to the rotation, it will expand. Okay, it will expand. So this is the technicality. Okay, we have to know that this is the basic things which are not important for us, but if we know that about that, it's okay. So basically, we have today we will discuss basic things. Okay, so what type of scans to be done? Okay, okay, various structural problems. This is called investigation of choice for structural changes. So in body, if you get some sort of structural changes, so which scan is best? Okay, to know the accurate problem. Okay, so if a patient have any air, okay, air containing structures, okay, like we have lungs have air containing structures, other spaces like abdomen. So what type of scans to be done? Okay, so basically for that, CT is the best option. CT, computer tomography, is the best option. Okay, for air containing structures, so it will give the accurate problem, accurate details. Okay, if you want to know about the fluid like ascites, yeah, fluid in kidney. Okay, so the best investigation of choice is USG, ultra sonography. Okay, so this is the best investigation of choice. Next, if you want to know the calcification, okay, calcification. Basically, calcification means there is deposition of calcium. If the deposition of calcium within the parenchyma means within the cell, within the structure of the uh, organ, okay, we will go through USG again, like gallstone, GB stone, calculi, renal calculi. Okay, all this need ultrasonography because it is within the structure of the organ. If it is outside the parenchyma, okay, outside the parenchyma, we again will go to the CT. CT is also known as NCCT, non uh, computerized, non-contrast computerized topography. Okay, contrast. Again, yesterday I told you contrast means what. Okay, again we will discuss, we will come in detail. These are the various important tests whenever they required. So for air containing problems, you need CT or NCCT. Fluid, if you want to know the any problem is there, if you want to know the there is any fluid accumulation, So go through the ultrasonography. Calcification is there, like stone. Okay, you want to know about the size of the stone, where stone is exact place is there. You want to go to USG. If calcification outside the organ, okay, like we have osteoarthritis of knee, okay, rheumatoid arthritis of knee. This is also the calcification of some deposition are there in the knee. If it is severe, or if you want to know the structural things related knee, then you have to go to the CT scan. Next is blood. If you want to see the blood in investigation to rule out whether there is any trauma, like anyone fell down from the bike or accidentally he hit his head to the any area, or accident happened with the bike. Okay, so at that time you need again NCCT. Bleed also you will able to see in LCCT. Okay, like in the brain we have SDH, subdural hemorrhage, EDH, epidural hemorrhage. All this we can see with the help of NCCT. Next, if the bleed is macro, go with NCCT. If the bleed is micro, what we have to do? Then again, we have to go with MRI. Okay, we have to go through it MRI. So this is very important. Now, soft tissues like muscles, tendon, ligament, soft tissues like muscles, so tendon, ligament, all this need MRI. Okay, like vertebral column, okay, disc, okay, all this is disc prolapse, like cervical problem. You want to know the disc, which disc is affected, so you have to go through MRI, soft tissue, that is. Okay, next we have MRI, bone marrow. Okay, bone, in the bone marrow you have we have bone, sorry, in the bone we have two things, cortex and marrow. Marrow inside the bone, cortex outside the covering of the bone. It is very hard shaft. Okay, for the shaft you can go through NCCT. For marrow you need MRI again. Okay, and like in the bone, not only bone marrow, you will be able to see the veins, arteries, like uh, avascular necrosis. Okay, all this able to see. Next, only hard tissues, hard tissue, like mostly hard tissue is, what is the hard tissue in our body? Can anyone? So hard tissue is bone. Okay, so for bone we need X-rays, hard tissue. Okay, hard tissue we need X-ray. So that's the reason whenever any, any fracture, any accident, any pain related things happen, so doctor will advise X-rays. We will go to first time, you have neck pain, okay, neck X-ray, back pain, back X-ray. So how can you write about the X-ray? So this is the prescription you have to advise first thing, and second thing is X-ray. What is X-ray of cervical region? Cervical X-ray. So in that we have positions. We have different position: anterior, posterior, lateral, okay, sagittal, etc., etc. Okay, so which position you want? So mostly we need both AP and lateral. AP anterior to posterior. I need the location, and lateral from the side view also. I need that. So this is how you can write in the your prescription pad about the cervical X-ray. And we have X-ray again, lumbar, thoracic, thoracic, X-ray, lumbar. So likewise, you have to write. And we have X-ray, chest. Next X-ray, very important. That is knee, AP, lateral. So which knee you have to mention? Left knee, right knee, or both knees. Okay, this is the important thing we have to remember. So heart tissues, we will get X-rays. And for vascular vessels, we have two types of vessels, veins and arteries. Veins bring the deoxygenated blood. Okay, veins bring deoxygenated blood, and arteries can take the oxygenated blood. So for that, so these are the vasculars, vessels. For vessels problem, what we have to do? We have to do the tests like Doppler test, Doppler study. Doppler study is the study Doppler of venous Doppler, arterial Doppler. So which areas, arteries you want to see? Okay. Lower limb arterial Doppler means lower limb arteries can be tested with the help of this test. Or veins, lower limb venous Doppler, upper limb arterial Doppler, upper limb venous Doppler. So this is the important test for whoever have related issues of circulation, like varicose vein. Most of the most of the most of us have an idea about varicose vein, or other than that, like any arterial blockage, venous blockage. Okay, so all these are we will get in this Doppler sheet. Next we have angiography. You know that angiography to check the uh, arteries of heart. Okay, so this is how you can check the veins and arteries of the body. So these are the various tests. Okay. And nowadays, most of the people suffer from foreign body, like some baby took uh, uh, any pencil, rubber, okay, or else any metallic, okay, rupees, okay, okay. So see, sometimes pen also, nib, okay, nib. So they will swallow some. So what is the investigation of choice? If the person have any injury to the eyes, some glasses are entered into his eyes. What is the investigation of choice? So the investigation of choice is NCCT, and MRI is contraindication, because if it is metallic substance, MRI have positive resonance for magnet. So what it will do? It will acquired. Okay, it will acquire that. Okay, so these are the investigation of choice for different tissues in the body, different structures in the body, different structures in the body. Okay, so we have the important radiation. Radiology is about radiation, radioactive waves which are generating from that tube. So some are ionizing, some are non-ionizing, some are ionizing. Ionizing is nothing but positive. Non-ions, ions, positive ion. Okay. cation, anion. Okay, all this will come in ionizing agent. Non-ionizing, okay, non-ionizing, ionizing. Non-ionizing easily uh, can easily done without any side effect. Mostly they have rare side effects, but in the ionizing we have to take care about that. Okay, uh, we have to stop, or sometimes we have to stop that radiations by affecting ourselves. Okay, without any needed purpose, we have to avoid this. So in that non ionizing, we have X-rays. So whenever we require, then only you have to advise the patient. But because if the exposure of X-rays happen, the patient will have severe issues. CT scan, and other than we have DEXA scan, okay, fluoroscopy, okay, DEXA scan for bone mineralization will seen. Okay, in the ionizing we have other types of scans also, like nuclear scan, whole body scan for like PET scan. PET scan is for diagnosing purpose of cancer. Okay, non-ionizing, in that we have two things, that is USG and MRI. So these are the safest scans, okay, which have their own side effects also, but comparing to ionizing, non-ionizing are much more less problematic. Okay, and second thing, that that's the reason USG is done during pregnancy. Okay, ultrasound. Some patient had any injury due to the brain, or any paralytic attack, or anything happened, the doctor also advised the MRI to them. So why? Because ionizing, non-ionizing concept. Okay, this is the important thing we have to remember. Next is effects of radiations. What will happen if the effects of radiation is there? Okay, so this is the last topic in today's class, effect of radiation. Basically, if the ionizing radiation are going throughout the body, pass throughout the body, we have two effects. One is immediate effect and gradual effect. Okay, immediate effect means if you affected with that radiations or X-rays or ionizing agent, so it enter into our body, and if it is in normal range, it will not cause any harm. Example, like your weight is 100 kgs, and your body have capacity to bear 10 to 15 wavelengths. Example. So at that level, will if the person doesn't have anything, after that level, if it increases after 15, so the body start doing giving its effect. Like what will happen? Problems are same, okay, for immediate effect or lateral effect, but immediate effect will seen after entry of more than normal dose, like vomitings, nausea. Patient will have vomiting, nausea, okay, and skin injury, blood infection, GIT disorder, or nerve and blood vessel disorder. Okay, these are the gradual onset of, not gradual, sudden onset of the symptoms gradually, then patient will die. Okay. So these are the more than required amount of waves are enter into our body, so the patient have immediate effect. Lateral effect, what will happen? Lateral effect, like some person is working in MRI, X-ray room. Okay, he's a technician. He have to work there, but his exposure to the X-rays are in. He is having the protecting agents like gloves, his cover, his hat, anything, everything is there. But he is exposing to the X-rays daily. He is exposing. So gradually, what will happen after completing of 10 years, 20 years, 25 years? Okay, he will have the large amount of X-ray exposure. So then he will have the symptoms. Okay, that is vomiting, nausea, okay, skin allergy, blood infection, GIT disorder, nerve and blood disorder. So he will get lateral side effects. Okay, some have immediate side effects. So it is depend upon the rays which are used in the radiology tool. Okay, so if you expose to any type of X-rays are different types, like we have alpha rays, beta rays. These are the names of the rays, not as much more than gamma rays. Okay, so we have alpha rays, beta rays, gamma rays. So alpha rays are much more lesser than beta rays. Beta rays are much more lesser than gamma rays. Gamma rays are higher than all these rays. So gamma rays have the ability to damage the DNA. What it can do? It will damage the DNA of the body. Okay. So this is very important thing. So it is depending upon the race, the damage of the body occurs. So we discussed investigation of choice and how X-ray is produced in the tube, and after that, different types of structural things are there in our body. So what is the investigation choice? Okay. And second is ionizing and non-ionizing agents and side effects of X-ray. What will happen? And we have different types of X-rays. Okay. So this is all about in today's class. So anyone have any doubts, kindly ask.